will you be going for dialysis for life, or would you want to do a transplant along the line? So this is one thing that you need to actually figure out what you're going to be doing. Do you want to go on dialysis? Do you want to go on transplant? So if you want to go on dialysis, you need to know and you need to make up your mind that what you actually need is at least 3 times dialysis in a week. So in this part of our world, in Nigeria, 3 times dialysis looks like a fairy tale, something that is not actualizable because of the level of poverty in the society, because of finance and lack of government interventions to help those who have kidney failure. So having note that it's actually very important. Like you can't talk about dialysis without talking about money. Even at this point in time, everything revolves around money. So you need, as a standard, you need 3 times dialysis. Okay, so every other thing, any other maybe doing once in a while, and so the best is 3 times, at least 3 times dialysis in a week. So if you can't afford that, we'll be praying for finances so that you'll be able to afford that. So 3 times dialysis, you need to either you're going for dialysis or you're going for kidney transplant. So when you're going for also dialysis, let me still talk about dialysis. You also have to figure out if you're going to be doing hemodialysis or you're going to be doing peritoneal dialysis. So you need to get knowledge about this to then know the one that is more effective for you. For some factors, for some reasons, we measure on hemodialysis here in Nigeria. That's why I talked about 3 times dialysis, which is different from what you'll be doing if you have a PD. Okay, you can be doing, the PD stands for peritoneal dialysis. You can be doing it once every day or even multiple times in a day. So we have the one we call night dialysis. You can run it, So having said that, we're now going to transplant. So if you're going to be going for transplant, for the meantime, you may need to be doing dialysis before you finally get your new kidney. So as you're planning for that, you also need to go for your tests, test to ensure that the donor and the recipient's kidneys match. You also need to go for raise money for that procedure and also plan for life after transplant. I discovered that most people do not plan for life after transplant. They just, I want to do transplant, I want to do transplant. But it doesn't end there after doing transplant. You also need to plan for life after kidney transplant. I don't know if I'm communicating. Okay, life after transplant means that you're going to be on immune suppressant drugs that will actually suppress your immunity, okay, so that your body won't reject this new kidney that has been given to you. So you need to make sure that the source of this, the source that you'll be getting your drugs from, like, is steady. You don't just, maybe you're taking drug A and you discover that it's cheaper at drug B, you switch over. So by the time you switch over, you may actually have something that is very ridiculous. You may have something that won't work for you, and the new kidney will actually fail. Okay, so if you've known a source that you're going to be using, it's very much advisable that you maintain that source. Don't run around the bush. Don't just maintain that one source. So having said that, we're going to talk about number 4. Okay. I need to take a cup of water. So we talk about number 4. Number 4 says that you need to know so much about your diet. Then I want to also state in this video that for people who have dialysis, people who have kidney failure, there is something that is not common for everybody, and that is diet. Okay, for me, I think that diet actually is different from person to person according to their personal needs, according to the results of their kidney function tests, urea creatinine levels, and all the rest of them. So, and your what they call it, your dietary plan is also dynamic. Okay, what your dietary requirements might be in this week or in this month might not be the same thing it's going to be next month because of variations in your chemistry results. So you have to know this and follow up with your dietitian closely to make sure that these things are maintained. Okay, this is actually going to be one of the longest video I'm going to do. I don't know if I should do it part one and part two so that it will be easier for us to watch, because the time I'm seeing here, it's running into 13 minutes already. So what am I going to what am I going to do? What am I going to say right here now? What I'm going to be doing right now after this, okay, you are now on diet. What you're going to do is, number one, is that you need to know that one of the key things you watch out for when you have kidney failure, when you're placed on diet, is that most of the times you'll be on salt restrictions. Salt restriction is one of the diets for kidney failure. You'll be on certain proteins will be restricted for you. Then you also need to watch on your potassium, your potassium intake. You also need to watch on your phosphorus intake, phosphorus and calcium intake. Okay, so these are the things you need to watch out for. That's for every diet. Okay, this is the guide that will be used to work on those diets. Then we also have this other one, fluid, very, very important. Fluid, you got it right, very, very important. So you also watch your fluid intake as a dialysis patient. So all these things come together in your dieting as a kidney patient. So you need to, like I've said, it's dynamic. What it is today is not what it's going to be tomorrow. So you have to watch it out. So what if you come to a dialysis unit, what A is eating might be different from what B is eating. So they may follow the same guideline: low sodium, low potassium, low fluid intake, and what have you. But the requirements, the core dietary requirements may differ. Okay, then the last but not the least, you can't be managing kidney failure without proper medications. So you need to take your medications right from your BP medications, your intra-dialysis medications, the heparin and all the rest of them. You need to be taking them properly. A lot of people come in after first-time dialysis, use that period to know the patient. Some will have very serious hemorrhage because of blood clotting factors. So you need to, and lack of proper heparinization, so it will cause a lot of things in there. So you need to know your patient. You as a patient need to know yourself so that you can actually discuss in-depthly with your management team in order to come up with something that is very, very peculiar for you. So we also talk about proper medications. We have drugs that you take after dialysis. We have the erythropoietin, the iron sucrose, okay, drugs that you take to build up your blood. We look at even the normal drugs you're taking, the BP drugs, the BP talks about high blood pressure drugs, diabetes drugs, and maybe a few other complications, drugs that can help the heart function well. A few other drugs that the doctor might deem fit for you. So you as a person who is having kidney failure need to have knowledge about that, or you as a caregiver to someone who has kidney failure need to also know about these drugs and their side effects, so that when you are reporting, you can actually report properly. Then you also need to be aware of the things that happen intra-dialysis, okay? So that with a good knowledge of things that happen intra-dialysis, you'll be able to do what to advise your patient, your relative, or your person properly. Okay, so with that, we'll be calling it a quit. Maybe sometime along the line, we'll be talking more things about kidney failure. So if you actually learned a lot from this video, I want you to drop a question if you have a question on the comment section. Please share this video. Like I said earlier, this video is worth watching in the dialysis unit. Okay, you can share it to people who you are dialyzing with, that you've gotten something that could actually help them. So don't forget to share. I'm Honorable Victory, your kidney health coach with over 5 years of working experience helping people who have kidney failure to become sound again. So bye for now.